Hi there, I'm Janelle Marie. Welcome to Body Beautiful. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Joseph Mele, and we're talking about a couple different subjects. We always love to talk about this with Dr. Mele. Mommy makeovers, breast augmentations, liposuctions, and arm lifts.
I like variety.
Which is very exciting. All right, before we get started, remember, any advice we give you today, consult your own physician before you do anything. All right, Dr. Mele, thank you for joining us again.
Nice to be here.
Nice to be back. So let's talk about very popular procedure now, mommy makeovers,
Sure.
right? You're seeing a lot of that coming in now?
A lot, yeah.
What is that?
There's a lot of mommies out there.
A lot of mommies out there, new mommies.
New mommies, and hopefully done having baby mommies.
Yes.
Because that's usually the best time to do this.
Absolutely.
In the pregnancy, it tends to affect the breast and the belly.
Right.
So any combination that's improving both those areas, we kind of call it mommy makeover. So typically it's a tummy tuck and breast augmentation, probably the most common.
Oh, okay. So is it only breast aug and tummy tuck?
No, it could be breast lift and tummy tuck.
Okay,
it could be, liposuction rather than the tummy tuck, or even a mini tummy tuck. Just something that, whatever needs to be done to refresh that area.
Now, I know a lot of women, after they have babies, they always complain about stretch marks. Can stretch marks go away if you take enough skin away, or how does that work?
The stretch marks that are below the belly button in the middle, because with the tummy tuck we're removing that skin, then they go away.
Okay.
But I don't have any cream or laser that's really particularly effective for that. Though I see them advertised a lot, just doesn't work very well. Some of the more red stretch marks we can lighten with lasers, but the white ones that are kind of fully mature, there's not a lot we can do.
So let's talk tummy tuck first. How do you do that, and what's involved?
So a tummy tuck, what we do is we figure out what skin is excess.
Yeah.
Usually we can pinch that, and if the skin's folding over, we know that there's more skin than there needs to be.
Okay.
So we'll kind of measure that out, and I make an incision during surgery very low, so it's like at the bikini line or just below that.
So your bikini or your underwear will cover it?
Yes.
Okay, good.
And then usually I'm removing skin to just above the belly button. So when we close it, what I do is I leave the belly button on the abdominal wall and then make a new little buttonhole for the belly button to come back through.
So do you tighten the abdominal muscles as well?
Absolutely.
Oh,
yeah.
that's
wonderful. It's rare that I don't. You know, but if someone's had children or they've gained weight and lost it, the muscles tend to separate. They tend to pull apart.
Right.
So while we're in there, we repair it. But there's no vertical line on the outside from that. That's all done underneath the skin.
And so what are the advantages of having, combining breast enhancement and also the belly enhancement? What's, why is that good together?
It's good together because if both areas are bothersome, you can get them fixed at the same time. There's one recovery period.
That's nice. So what is the recovery period?
Recovery period is a couple weeks.
A couple weeks for both?
Yeah.
Oh, okay.
Yeah, for augmentation alone, usually a week is enough. It's still sore at a week, but you can get around, do what you need to do other than real heavy lifting or repetitive stuff. And with a tummy tuck, usually it's a week or two.
And then do some women go in for the breast aug, or can you just go in and do the enhancement? I mean the lift, the breast lift.
Oh, absolutely.
Oh,
You can do just a lift.
Oh, that's nice.
Probably the easiest way to tell is if in a bra the size is correct and you don't want to add more and it's filling the cup appropriately,
then you don't
usually
need to
just
add
doing
more.
the lift is plenty.
Oh, that's nice.
Yeah.
We've got some pictures. Let's take a look at our first one. All right, what's going on here?
So this is breast augmentation with a tummy tuck.
Very beautiful.
So we've enhanced the volume of the breast. The shape was fine before. The nipple was in the right place. Didn't need to do a lift or anything. And the belly, you can kind of see that shadow running down. It looks like the middle of her belly on the side. That's the edge of the rectus muscle. So afterwards, you can see how it's pulled around to the front where it belongs. That also helps enhance the waist a little bit too.
And it also looks like you got rid of stretch marks in that one too.
Well, the ones that, again, if they're below the belly button,
they're
leave
gone.
with the skin.
Love that. That's a good, let's take a look at number 2.
That's why it's such a popular procedure.
That is now do...
So similar here.
Okay,
Added volume with an implant, and again, tightening up the abdominal skin. Now, in her case, not a lot of loose skin folding over.
No, there wasn't a lot.
But the muscle is really lax.
So you tightened up her abdominal muscle in that one?
Yeah.
Oh, that looks really good.
But even in that case, I can do a full abdominoplasty. There's enough skin to do that, and it helps to tighten what's left.
And then does the scar go away? I mean, it's a scar that will fade pretty nicely.
There are things that we'll do afterwards. Like right after surgery, there's a steri strip on there which helps keep it smooth and give it support. But once those come off, I'll use Embrace, which is a silicone sheet that goes on that's pre-stretched and kind of pushes the scar together, which also helps it heal better.
Oh, that's good.
And the silicone topical also helps well.
Because you want to go back into that bikini after you've had the babies,
right? There you go.
All right.
So here we've done a lift with augmentation. So we added a little volume to add that upper pole fullness, and done a lift to get the breast back off the belly, get it up higher.
That looks really good.
Along with the tummy tuck. And in this case, I also took some of the fat that we'd liposuction and put it in the butt.
Oh,
So we did
okay.
a
I was
little
going to ask you
Brazilian.
about that.
Yeah, so it rounds out the buttocks a little bit, took off a little bit of that shelf that was higher, you know, on the view from the back, which is hard to disguise on TV.
Yeah, but
you can take away that extra love handle area.
Oh,
and
that's
basically
wonderful.
I can change the shape from sort of an inverted pyramid back to more that
Nice
pear shape that
rounded
we
shape.
like. Yeah.
That's becoming very popular too, by the way, right?
It is.
A little fat injected into the buttocks.
Get a few calls on that one.
I know.
So you were asking about just doing a lift. This
is that just a lift? Okay, so no augmentation on this one, just a lift.
Yeah, so the volume she was happy with, didn't want to be bigger. Basically just brought everything up, also reduced the size of her areola. You can tell by the size of the squares or the rectangles. And then the belly, did a tummy tuck to tighten everything up.
You know what looks, you can see the bikini in the after picture, and you do not see the scar at all.
The scar should be right in that line.
That's fantastic. How do you make the scar so small?
Well, the goal is good aftercare and also taking time in surgery to put it together in layers. And there's layers below the skin that give good strength and help keep that scar from stretching.
Fantastic. Very popular procedure.
It's a fun job.
It is a fun job.
I like what I get to do.
All right, for more information about Dr. Mele, you can call the office 925-943-6353 or check him out on the web, either drmele.com or sanfranciscobreast.com. We've got lots more coming up on Body Beautiful, so stay tuned. We got lots more to talk about. Plastic surgery. We'll be right back. Good job.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.